Would you like to show me love?
If we can just have your attention again. The two presenters are ready to go, so let's get underway. The two presenters here are Saeed Khosravi, who's just getting into position there, who is our Vice President for Ethics and Professional Practice Committee, Ethics and Professional Practice, and Jim Hlavac, who is the Chair of our Ethics and Professional Practice Committee. And there is a move afoot to revise the Code of Ethics, and I'll leave the two of them to tell you about it.
Thank you, Dave. And this presentation, which will go for an hour, so I hope you're well fed and ready for a lively discussion, is entitled "The Revision of the AUSIT Code of Ethics and Code of Conduct. Your questions answered." Well, before I ask you some questions and you answer them, or you ask me questions and we answer them, I might just recap what we're talking about when we're talking about ethics, codes of ethics, etc. When we talk about ethics, often we're talking about, in a general sense, what is the right thing to do at work. And when you think about this term, you might also think of terms such as, well, your principles, your honesty, your conscience, your values, etc. And all of these are terms which are really congruent to this whole discussion on what ethics are. If you asked a person, is that ethical? They might respond by saying, well, is it morally right? And the concept of morality is certainly a starting point to consider when we're talking about ethics. Ethics, though, is a bit narrow or a bit different from morality, because ethics in the workplace is really restricted to that workplace. What could be morally not so good might be something which is ethically defendable, or vice versa. So in our work lives, when we're talking about morality or ethics, we're narrowing it down to what our expectations are of ourselves, or we should and can and should have of ourselves, what others can have of us, and if they have expectations and beliefs about what type of behaviours you should be exhibiting, that amounts to quality assurance. That means that people can work with you with a level of confidence to know that you will be working in a particular way which conforms to their ethics, to their expectations of you. And in this way, ethics code of conduct for particular professions offer protections. They offer protections for us as practitioners, also our clients, the profession in general, and if you like, our product. Afterwards, when people have worked with us, they have a notion of the standard of practice that they witnessed or that they received. An overall type of concept that I also like you to perhaps consider is that at the end of the day, when we're talking about ethics, there's an overarching belief that ethics really should be something where we're prescribing to do no harm to others, or for harm to be avoided to others. And ethics is, as I've just said, a workplace practice. It's a thing which we enact at workplaces. It's also, of course, an area of research, and there has been in the last 20 years a great deal of research into what is interpreted translation ethics. And there are courses that you can do at university, Sydney, Melbourne, Monash, books you can buy. Some of you might have subjected yourselves to some AUSIT PD that I've led on the topic of ethics and translation, or ethics and interpreting. And of course, all of you know that in order for you to have got your credential with NAATI, you must have demonstrated in your training pathway that this included you learning about ethics for translation and interpreting. And if you can't point to that being part of your your training pathway, you then are asked to do a test. And most people who are asked to do that test then, beforehand do the NAATI ethics preparation module, which is free. And by the way, it's publicly available. You can find and locate it on NAATI Learn. And if you wish to do it, even if you're already credentialed, you can do it as free PD. It will earn you 20 points. So ethics is part of our profession. We know this. And this is what the current Code of Ethics and Code of Conduct that applies to our professional association looks like. You know it, all of you do, like the back of your hand. This is the second edition. The first edition appeared in 1996, this one in 2012. The 2012 edition included an expansion from just a Code of Ethics to include also a Code of Conduct, which included examples of ethical practice, etc., in an attempt to give some sort of guideline to how people can enact, bring it into real practice, etc. And there were two further smaller sections added as well to pay attention to the fact that some things just are specific to translators and to interpreters, and they're contained in those two latter sections. So it actually has 6 parts. Did you read the intro and the preamble as well as the main parts? That's a question which we'll come back to, because if we're revising this, do we have 6 parts? Do we want to have 6 parts? Do we want to have a Code of Ethics and then a Code of Conduct? So think about the form of the current code that we have. We're not the only professional association in this country to have a Code of Ethics, as LITA also has what they term a Code of Ethics and guidelines for professional conduct. AUSIT has 9 principles in its Code of Ethics, as LITA talks about 5 values, with sections underneath each value teasing out what each value can refer to. In general, there's very close congruence between both codes. For example, where you find in the AUSIT code confidentiality, you also find it here under value number 1, professional accountability, confidentiality, etc. The AS-LITA code, though, does contain value number 3, non-discrimination. And there are items listed there, non-discrimination, communication preferences, and deaf interpreters, which is an act of activism to deal with discrimination, autism, if you like, which some deaf people, hard of hearing people experience. And their code formalises what an interpreter does when they maybe witness to situations such as this. And if you like at their value 5, integrity in business practices, it spells out a few things which are not contained in the AUSIT code, namely business practice, accurate representation, and reimbursement of services. But overall, there's 90, perhaps 95% crossover between both codes. I'm going to talk now briefly about a few other professional associations' codes and what they look like. This is from the Association for International Conference Interpreters. They have 16 principles, if you don't mind. They have one which is entitled Disputes, respect for the profession. Their code also, it's not apparent here through the names of the principles, but they also talk about the ethical principle, which they consider an ethical principle, of ensuring that you are fairly remunerated. Fair remuneration, or remuneration for the services that you perform, etc., is the thing which is addressed primarily by the union, Professionals Australia. There is information, as you will have seen in your bag, about suggested rates for newbie translators, etc. But in the main, the AUSIT Code of Ethics has not talked about remuneration, etc. But the AIC one does. By the way, there are literally dozens and dozens of codes of ethics, and not just in English, of course. We'll be the revision group, which I'll be talking about later, will be talking about other codes that we'll be having a look at. This is a code from an organisation it's actually an organisation of in-house interpreters, pretty much. They're not freelancers, they're in-house people who work for a healthcare facility in California. They talk about their ethical principles first, and then they spell out, when you're working as a healthcare interpreter, you have a pre-encounter, which is like a briefing, during the encounter, how you work, and then post-encounter, which we term the debriefing. These are principles of work practice, if you like, which are not found in the AUSIT code, but which are found in this one. It goes further. This guide also talks about guidance and roles and interventions. And one of the most controversial things, because many people have talked about this, is does the role of the interpreter change? Now, this code does not go as far as to say you should do anything, but it outlines your role if you wish to change from your usual impartial role. And that is, if you become from being a message converter to a message clarifier, where you paraphrase, where you add information, perhaps because there's a health literacy issue. Thirdly, do you clarify things because there's no logical equivalent? And cultural clarification works both ways, where you could be clarifying both to the health professional as well as to the limited English proficiency patient and patient advocate. And it spells out what actions an interpreter needs to be mindful of if they want to wander down the path of becoming a patient advocate. The ATA, which is focusing basically on translators in America, their code contains these 7 principles, which are again very, very congruent to the AUSIT one. So this was just a very brief comparison of 4 different codes, etc. When we look at this, and we've looked at other codes as well, what we can see is what types of principles or values tend to be frequently represented. And in bold, you can see those which are very commonly represented. In plain style, those which are fairly common. And in italics, those which are less common in our current AUSIT Code of Ethics. And you can see that the outliers are the principles clarity of role boundaries and professional solidarity. Those are principles which are not highly represented in other codes. If you recall the changes that occurred in 2012, clarity of role boundaries was something new, and it was a thing debated amongst those who designed the new Code of Ethics. So we have undergone expansion, if you like. So, as Dave said, I'm the chair of the Ethics and Professional Practice Committee, and part of our brief is to also look into whether AUSIT needs a new revision to the Code of Ethics. And the consensus was that it does. So a working group we were tasked with forming a working group, and the members of that working group are the people listed here. Saeed, as the Vice President, is amongst them, and I can see Michelle Miller and Stefania is here, and thank you to those colleagues who put their hand up. Thank you all to those who put in an expression of interest. We had a large number, we couldn't take everyone, but we endeavoured to have a mix of members that included Indigenous languages, Auslan, and translation. So translation sometimes gets a bit overlooked in discussions or in working sometimes. We are also very fortunate to have a project manager and a research assistant, Epeli Zhang, who's here as well today. And at this point, I'd like to say thank you very, very much to the sponsors who enabled us to have a paid position, the project manager and research officer. Those organisations are NAATI, Language Loop, Multicultural New South Wales, Human Services from South Australia, and also in-kind support from TIS National. So what is this working group doing? We actually started work over a year ago, didn't we, Carl? Working with potential stakeholders in securing funding in the first place. As you know, there was an announcement welcoming expressions of interest. When we look at this timeline here, where we're at is the working group has been convened. the working group has designed a questionnaire. That questionnaire will hopefully go out to you as members of AUSIT by the end of this month, or perhaps at the start of December, because we're keen to also hear from all AUSIT members what they feel is good about the Code of Ethics, what is not so good about it, and lots of other things which will where will elicit your opinions. That invitation for a survey will go out shortly, I hope. I look at Carl and he nods and gives me a thumbs up. So I hope that will be shortly in your inboxes. That survey will be open for 4 weeks. And this will form a database for us to know, okay, what is the AUSIT membership's opinions about the Code of Ethics? The working group is also looking further afield. I mentioned before that there are lots of codes of ethics across the world, and we'll be looking at what they look like from other translation and interpreting professional associations. We'll also be looking at the codes of, let's say, related professional groups such as nurses, journalists, social workers, etc., to see what they're doing, because they're often service groups that we work with. But we're also interested in the form. And when I say form, the Code of Ethics in the current manner is a PDF document. It's static. It's a text only. Are there examples of codes of ethics being out there and they're actually web-based with hyperlinks to particular examples of good practice, etc.? This is, it's 2025. Should we think about a different form for the Code of Ethics to be actually available in? And we'll start drafting. And this drafting process will include the whole group on the basis of a literature survey, what's out there across the world, what are your responses as AUSIT members, etc. And once that we have our first draft, we'll be then passing it on to others outside our group for review. They'll come back with feedback. We go back to the drawing board, draft the second one. It gets finalised. It goes out to another group of external reviewers. They come back to us, we go back. A third draft is then prepared. That will then go out for final review, and we're hoping that the fourth and final one will be ready for you, hopefully by the end of 2027. I know that sounds far away, but the consensus is that we need to take time to get it done well, rather than try and do it promptly and perhaps have an outcome which is not what we want. So thank you for this overview. I'm going to now hand over to Saeed, who has a QR code to share with you because, like you like to do, there's now the chance for audience involvement.
Yep. Thanks, Jim. It's never easy to talk after Jim. He's, unlike him, a soft-spoken gentleman. I'm very loud and all over the shop, so sorry about that. Now, I'm going to share a QR code with you. It's the survey which was designed and it's aimed towards the practitioners. So may I please ask only the practitioners who are actively working right now, only scan the QR code. That, and mainly because we were not expecting such a fantastic turnout, there is a limit of 50 people for this survey, okay? I was not meant to say this one. Now, I'm just going to share that. So if you can scan this, again, as I said, because the questions will ask you, and it's only a taste of what you're going to get in your emails in a few weeks' time. Carl.
So the first question is to you. What do you see as the purpose of? What is the purpose of a code of ethics? And you have 5 choices, and we'd like to invite you to select one. Can you select multiple ones?
Yes, you can select multiple ones. And again, it's a very small sample of the questionnaire you're going to receive. The actual questionnaire is going to have room for comments and that. Yeah, but that's the best I could design for today. Sorry. Sure, that's more than 49.
If I can put in multiples.
Yeah.
So we've got our backs to you. We can't see it on our laptop, so we're kind of compelled to turn around. But that's just about everyone's voting for that first question. Oh, not
Still
quite.
coming? Yeah.
Sorry.
Jim, you're hands-on from both sides, don't worry.
Pardon? You have to click, if you want all of the above, click.
All of the above, yeah. But that's going to keep everyone busy. Right, next one. Oh, that's a good one.
Okay, so think please back to an ethically challenging situation. What did you do? What guided you? Did you immediately think of the code of ethics? You did follow the code of ethics and it helped you. I mean, that's the function of it, because when I've taught ethics to trainees, etc., when you do not know what to do, ask yourself the question, what does the code of ethics tell me to do? In the absence of any other idea what to do, this is supposed to be a guide. Number 3, I followed the code of ethics and it didn't help. I didn't follow the code of ethics as it just didn't seem appropriate.
I'm going to find those 3 people. We can't see the names, it's anonymous. Shall we? The thing is, I can't see it here on the screen, that's why I have to get...
There's 10 more to come, so the right-hand side, 48 and 50.
Oh, yeah, 48 out of 50, yeah. Well, thank you, everyone, because this is really going to help us, with the update. 4, okay? Shall we? Before that becomes 5?
Will it go up to 58 or it won't go up to 58 on the right?
It's going up, right?
Maybe 49 is still there.
Yeah. There are a few other questions left, so.
Okay, that's great. That's interesting, thank you. Say next question.
Now.
Okay, so we have 9 principles. You know them all off by heart. How relevant is each principle? What we're trying to say is how many principles should be kept for a 3rd edition, etc.
Sorry.
Is there a QR code for this one?
It's the same.
It should be the same sort of...
It should be the same, Heather. Yeah, so this one is like a slide, My teenage daughter helped me design this one. Yeah.
So there's 5 options, etc., indicating where you can indicate your level of what you believe to be its relevancy.
That's good.
You can only see 4 here, but we do have 9 on your phones. You should have the 9 principles.
Yeah.
And
next page, they're going to see the other 5 in the following page.
So there's pretty high levels of agreement that all of these principles are relevant. So that says to us that you think that they should be retained.
It's good. And the other 5?
Saeed, is that open? No one's been able to place.
0 out of 58. Yeah, there it's up there. We're sitting in the first row there. Professional solidarity, you dub in on other interpreters or not, and yeah. Yeah, I know, yeah. We don't like each other, apparently. Yeah. Yeah, professional solidarity is us looking after each other. Yeah, in the back, yeah.
Yes, that's right.
You brought it on 3.9 there. Yeah, we were expecting a higher one. Ready?
Just on that note, professional solidarity, Sebastian Robin from NAATI is here, who's in charge of the ethics test, etc. And I have to disclose, I have had a hand or worked with Sebastian extensively, and looking at the tests that are done by candidates who do the NAATI ethics test, Sebastian, if I'm not wrong, perhaps professional solidarity is the principle that candidates have the most problems with?
That's not very good captioning, Nazi ethics.
But Sebastian just said that's correct. So maybe that also, if we do want to retain it, then we have to do it in a way which makes it accessible and understandable for trainees and practitioners. Okay, what is your view on the current code of ethics? And I'm sure there's many of you who think that absolutely nothing needs to be changed, and if you believe that, you can tick the first option. But if you do believe that changes need to be done, you can scale your position accordingly, and also with some variation.
I think there is one more left. I think that's where we can ask questions. Do we have time?
Yeah, we have until.
It says the responses are hidden. You know why? I've probably accidentally hidden the response. So show responses. Yeah. That's how much I know about technology.
Okay, so there's only mid-level support for the combining of the code of conduct with the code of ethics, and having separate codes for interpreters as opposed to translators, but the consensus is certainly there that it needs to embrace what's happening in the AI space and various technologies. Thank you, that's interesting. One more question. Do you have any other comments or suggestions about AUSIT's future code of ethics and code of conduct? You have a limit of 200 characters. We welcome your responses.
I didn't put that limit there, otherwise it would be 10.
So type away if you would like to convey a particular position. So it will actually appear. Let's start to appear.
You're usually going to see no one has sent it yet. We're going to see that. Maybe I should tell them we're going to see the comments.
We will see the comments.
Don't write any bad things. We're going to see the comments. Yeah. No?
That was 2 characters. You can use 200, but it's up to you.
Yeah, nah. How can I get rid of that? Oh, I just figured this out. Sorry. Can't promise anything, Jim. Yes, I can. Wow.
Okay, so that's 25 responses so far. Thank you for those who have entered them. And for those who haven't, feel free to still do so. Look, this was an intro, if you like, into what questions and things we're dealing with as a working group. And also what you just said as a sample of AUSIT members in this survey elicitation. As I said, there'll be a survey. It'll be more extensive than this. It's about double the length. There'll be about 12 questions, etc., and more elaborate than this one. So we're really, really interested in responses. But thank you for those who have responded this afternoon. So this more or less concludes what Saeed and I would like to convey to you, or we're now open to your questions, because the title of this is Your Questions Answered. So if you have any questions, we're more than happy to field them. And we've got some roving mics. Take this one.
I'm going to leave this open for you to send your comments. Yeah. Not close it. Leave it open.
Just a really quick question. Jim, you mentioned reviews at different stages. So who is going to review? Any particular organisations, stakeholder groups? Who do you have in mind?
The people we have in mind are representatives from some of the sponsor groups who have funded the project manager research assistant position, NAATI, PA, AALC, translation and interpreting ethics researchers based in Australia and also New Zealand. The NZSTI will also be one of the review parties at the third stage. And there are Aldous Ozelens is also, as the previous leader of the revision of the second edition, has kindly also said he's happy to be a reviewer. So there will be a range of reviewers from different stakeholder groups. They will be industry-based. So the AUSIT Code of Ethics is for us practitioners. It's not for consumers or users of translation and interpreting. They're the beneficiaries through our ethical practice. But the document is not for them. It's for us, or people working with us in our area through training, research, etc.
My question is just part of your answer. You said that there will be consultations with different agencies. Is there any chance that interpreters themselves will be involved in this? Because a lot of things are changing. And there's a new terminology coming. There's a new needs for health interpreting are showing up now. So is there a chance for interpreters to be involved in this review and have their opinion taken into consideration when there is changes of their code or reviews?
Amongst the reviewers that we will be having are practicing interpreters and translators. But I would like to restate the best opportunity that interpreters and translators have to make their voice heard is by responding to the survey. Well, Heather just said that's if you're an AUSIT member, and that is a requirement. If you look at the current preamble, the Code of Ethics is developed for AUSIT members, and it's binding on AUSIT members, etc. Through other developments, such as the regulation and protocols developed across the interpreting and translation industry in this country, the AUSIT Code of Ethics has, for at least spoken language interpreting and translation, become the national standard so that all translators and interpreters are obliged to follow it, regardless if they're an AUSIT member or not. You'll see this in NAATI protocols. You'll see this also in the LSPs that you work for. Regardless of whether you're an AUSIT member or not, you're obliged to follow it.
I've just got a question. What happens to situations when you go to a session and there is a specialist or a clinician who is desk hopping with his... And I'll give an example. It's a classroom setting with 10 or 5 desks, a nurse at each one, patient and a therapist perhaps, and then the specialist is just desk hopping in an open environment. What happens to all of our ethics there on many levels?
Can you locate a particular complication which has consequences in your ability to perform ethically?
Well, firstly, you're not in a private... The Privacy Act factor comes in on all sorts. You are there in an open environment where everybody can hear you. And the situation that you're in, how does I suppose I'm surprised that it's actually even allowed to happen. That's where I'm coming from.
Interpreters and translators, interpreters in particular, work under lots of different circumstances. At the end of the day, if it's a healthcare situation, the call is made by the clinician as to the level of, as the other interlocutors they're happy to have present. That includes family members. This includes other patients. The responsibility is on them. The responsibility on you is to interact with your client, the LAP client, and the doctor in a way which conforms to ethical practice. It's not up to the interpreter to tell the clinician what work conditions they should be providing.
No.
That's overstepping our role. That call is made by them. If you may think it's inadequate, at the point when the conditions impede you from performing your role ethically, at that point you need to alert the healthcare professional about these conditions and point out to them what negative effects these conditions are having on you in your ability to act optimally and ethically. And hopefully they'll act on that, that thing that you convey to them. At the point, if you feel that you are unable to work ethically and to the standard you want to, you need to elevate that and escalate it to a point where you actually complain to the health professional that you'd like something changed, etc.
Well, yes, because the noise factor and everything else will affect you. So, yeah.
Kia ora, Jim. Agustina from NZSDI again. I'm here. I wanted to say that SLIANZ, which is the ASLITA counterpart in New Zealand, so New Zealand Sign Language Organisation, is going through a review of their code of ethics, and the thing that they're doing is involving the deaf community, so the service users of interpreting side, so community side, as a first stop, and Maori, which is the indigenous people in Aotearoa, New Zealand. So even though codes of ethics are for practitioners, the codes of ethics inform what we see as interpreters' roles, and so basically then that's what interpreters use to go back to community and say what we can and cannot do. So I would argue that by consulting interpreters and academics, and you're creating some sort of echo chamber where we all agree with what we are doing and not really engaging with what might be out there. And I know in New Zealand, can't speak for Australia, but we have lots of communities like the Samoan community, the Tongan community, lots of communal, much more community-centred groups for whom the code, which is the same there and here, do not apply and it causes lots of friction. So I wonder if you were taking these things into account in your review.
These things are certainly in the back of our minds, but we have limitations. Yesterday we presented that, Emiliano, what was it, 42% of users of interpreting services did not know that interpreters have a code of ethics. So many users of interpreting and translation services don't know that there is a code of ethics. Now that's a knowledge gap, etc., and this is perhaps a project to address that. However, there are so many stakeholder groups. Where do we draw the line? Do we speak to every imaginable occupational group that translators and interpreters work with? And again, it's interesting to receive what the input can be as to how they view our work, etc. At the same time, we could be fielding a very, very large number of submissions that are unworkable. We have so many. I've been, and many people in this room have been in situations when clients have had unreasonable and misplaced expectations about what the role of the interpreter and translator is. I think that it needs to be a practitioner-centred project because it affects only practitioners in what we're supposed to be doing. I think that the channels of communication with various LOTs and also deaf, hard of hearing communities are open, but I would warn against extending the scope of submissions to so many groups that it becomes A, unwieldy, and secondly, to be honest, at the end of the day, I don't think we're going to be able to satisfy many of the requests, demands, expectations that such groups would have. At the end of the day, you also need to narrow down what your core principles need to be. The Code of Ethics is a very lean document. It can't possibly map out every possible situation that could eventuate. Instead, it has general principles, which then you need to consider as to how they could be manifested or operationalized in your work.
Firstly, I'd like to thank and congratulate all the work done by Code of Ethics Committee. And my question is that, how does AUSIT decide which committee gets funding? Like this, I understand that this one has a project manager, research officer, but some committee like to implement recommended standard for interpreters work in tribunal and court, I feel under-resourced. So I don't know if this is a question to you or Carl, or I don't know.
Mikoto, I'm happy to, Carl, feel free to come up here and respond. But look, this is a one-off. The last time that the Code of Ethics was reviewed was 2012, so this is 13 years later. It's not going to be finished till 2027, so it's once every 15 years. It does represent a fair bit of work. By the way, the people on the working group are doing this voluntarily. Yeah. So there is a paid position, there's a fair bit of work, and for that reason, we did take it upon ourselves to see if we could gain sponsors, and we're very grateful for their contributions. I can't pass comment on which other committees have received funding. I'm on the EPPC. We received no funding. We're probably similar to other committees, but I don't know, Carl, if you want to say any words, but that's...
May I just add, the document you mentioned was not designed by AUSIT, the one for court.
Yeah, you were referring to the recommended national standards in your question? Yeah, no, they're different things. So the Code of Ethics revision is incredibly important, and that's why we sought out funding from public LSPs and not from the private sector to ensure there were no potential conflicts of interest. And yeah. Oh, yeah.
So this is coming from outside your profession, so forgive me. I think it's wonderful that you are working on this Code of Ethics, and it's a very important document. Clinically, I've had a situation on multiple occasions where the interpreter has, mid-consultation, said, I can't continue with this because it undermines my principles. Typically a consultation about abortion, which we hadn't expected, and that's the way it had been, and then had refused to continue. And that is, on every occasion, that interpreter has said, this is my Code of Ethics. Now, that is actually quite oppositional to my Code of Ethics, where we would need to be continuing down that line, even if I didn't agree with abortion. I've had a look at the Code of Ethics for AUSIT, and I'm not sure, perhaps you can enlighten me about where that would be incorporated.
Good question. Thank you, Christine. That's a really good question. Had the interpreter known from the outset roughly what the thematic discussion could be about, that could have been an opportunity for them to then convey to you their particular problems with talking or interpreting about a particular topic matter that they have a particular opinion or position on. The relevant principle is impartiality, and it talks about your level of ability to interpret impartially, which you're required to do, is compromised due to your beliefs or your positions or your convictions, whatever, that oppose what you're being asked to interpret. And it has to be a pretty strong level of doubt that you have that you can work impartially, because this is a serious thing when you do actually request, and they should be requesting to withdraw and giving their reasons why, and it also facilitating if they do wish to request to withdraw. So if they can't impartial, and they're actually following the principle, I feel so strongly about this that I can't be impartial in conveying the information that you're relating to the patient. To make sure that you can relate that information impartially to the patient, I'm asking to be excused because I feel I, as a practitioner, are unable to do that. They should convey that to you, that that's their principle, that's the principle that they're invoking in having an issue that they cannot work impartially. And the Code of Ethics in that situation does allow the practitioner to state their position and to request to be withdrawn from it. It also contains that they are to undertake steps to make sure that the client is provided with an interpreter as soon as possible. That's also something that people overlook. It's an inconvenience if halfway through the interaction it comes to a point where they feel compelled to invoke impartiality and then assist you in finding another interpreter.
We've reached time, so there's probably lots of other questions or suggestions that people may have, but at this stage, we've reached the end of our time, and this time it really is not like this morning. But it just remains to me to thank Jim and Saeed for their presentation.